So this case is actually a continuation of case 3A. You can see that now the patient has had a small craniotomy done for evacuation of that previous subdural hematoma. They've placed a subdural drain within that where that hematoma used to be, and it looks like it's been pretty adequately decompressed on the left side. Now, the main finding here is this new hematoma that has developed here on the right side. Now, unlike that other hematoma, this one's a little bit lentiform shaped. And actually, when you go to the MPRs and look at this thing on the coronal plane, it's really quite strikingly lentiform in its shape. And that's a feature that you typically see with epidural hematomas. Now, you want to look at your sutures, make sure this thing doesn't cross any sutures, but it's kind of too small at this point to reach any suture, so we can't really rely on that, but it doesn't violate any suture. So if you were to see this, I would argue we should consider this thing to be epidural in location. The only thing being this patient was obviously in the hospital this whole time, and it would be pretty odd for an epidural hematoma to sort of develop, a day or a couple of days, I believe, after this thing was drained. So that was the only sort of red flag that this might not be epidural in location. And in fact, when they went to surgically evacuate this thing, because they thought it was epidural, there was no blood in the epidural space. It was only after they pierced the dura and went to the subdural space that they managed to evacuate this particular blood. So this is really a subdural hematoma that's mimicking an epidural hematoma. The only other thing here to note, again, you can see on these coronals, the nice falcine hematomas, the left transtent or subtentorial hematoma, and there's some new hematoma subdural in location along the right posterior fossa convexity here, which again shows up pretty nicely on the coronal view. You can see it on the axials as well. Here it is. It's got a little bit of a layering hematocrit level again.